Hello and welcome to Relationship Helpers. I'm Vincent Ketchy, your host. Last week I interviewed Dr. David Ludwig and he gave some valuable insight about communication in marriage. If you did not hear that message, please go to our website, relationshiphelpers.net, and subscribe to our podcast. Again, that is relationshiphelpers.net. You will hear all of our shows, and there are also valuable show notes and links to our guests on those pages. This week, Laura and I discuss that sometimes touchy issue when your help doesn't help. Laura explains how to get the help you need after a major surgery, a birth, or other debilitating circumstance. So without further ado, here's our show.
I'll never forget the words of my discharge nurse the day I left the hospital after having my baby via C-section. Tell people what you need. Don't be like the lady who had a C-section who was washing her breast pump parts while her visitor sat and cooed at the baby. This is great advice, but it's hard for some people to put into action, especially women who feel like they are expected to entertain guests even when they need to rest and recover.
That brings us to today's topic, when your help doesn't help. Different life events, surgery, childbirth, loss, can place a person in need of help and unable to fulfill typical day-to-day tasks. Laura, you've recently had a baby and was on bed rest before the baby arrived. What was it like being at the mercy of everyone else? By everyone else, I mean myself a bit of the time. So.
Well, I really don't think I realized how set in my ways I was until I had to give people orders from my couch, basically. It was a humbling experience, but it was also pretty frustrating. Sometimes I wanted people to read my mind. I think a lot of times I wanted people to read my mind rather than to have to explain how to do something. I also had to fight the urge to get up and do the tasks myself. I also had to bear in mind that people were there for me out of the kindness of their hearts and that I needed to extend patience with them out of gratitude for them being there for me.
So I was there out of the patience of my heart. That's what you're saying, right?
Yes, and I hope that you feel the gratitude that is just beaming.
Yeah, most of the time I felt the gratitude, yes. So you're saying it was hard for you not to get up?
Yeah, I was basically having to give up control.
Okay, so you had to really rely upon others during that time.
Mm-hmm. That's true.
Laura, you work primarily with women in counseling. I would imagine you see this crop up in your work, kind of what you were going through, I guess.
I do. Sometimes it's women with inner conflict. They're trying to get rid of some unrealistic negative messages they learned as little girls about how women should be.
What do you mean? What are some of those messages?
Well, that it's rude to ask for help from your guests, that you should be keeping up your household on your own without anyone else's help.
Okay, so tell me about those messages. Where would those messages come from?
I think that sometimes it comes from childhood. I think that, and this can be a very traditional way of looking at gender roles, depending on how you're brought up. If you come from a very traditional background, I think for women especially, it's prepare the proper home, make sure that you make 3 square meals a day. If you don't have your house clean and pristine along with that, then you failed at what you should do as your role as a woman.
So this role's kind of passed down from mother to mother, or maybe grandmother to mother?
Maybe so. It's just some kind of message that's passed along in families sometimes, and I think it's really coming to a halt these days as traditional roles are being broken by, women working outside of the home and men becoming more active in the duties that women used to do on a traditional sense.
So it's changing some. However, a lot of those older roles of where women are responsible for the household, responsible for cleaning the inside the house, mopping and vacuuming and dusting and also responsible for fixing meals and cooking or cleaning the bathrooms. That's still there, but sometimes there's this added responsibilities too with a working woman.
Yeah, I think too, just getting back to what we were talking about, is I think this has become more of a mental thing. I think that men have taken on more of these tasks, but women still have these remnants of feeling that they have to do these things.
So they're kind of guilting themselves or kind of shoulding themselves,
yes.
saying they have to do this, those kinds of things. So, I mean, it sounds like what you're saying is that for some people or some women, their identities are wrapped up in their household.
Yes, and when life gets in the way and you're at the mercy of others, you have to learn fast how to make it work.
So this, going on that, that a woman's identity is wrapped up in her household, so this is kind of the way her house appears is a reflection upon her, maybe.
Yeah, and like I said, this is really a relic of the past. It's not necessarily something that we're necessarily proud of, but still we struggle with that guilt.
Mm-hmm. So it's kind of held on to, and especially with, would you say with Christian women or all women?
I think all women. I think that there may be a greater propensity of women that are in the Christian realm that are experiencing this, but I think that it's a message that has passed along, these gender roles. And like I said, I think that it is changing, but I think more of what we're seeing now is it having a psychological toll of women feeling guilt over it as they kind of loosen their grip on what they used to do or what used to be expected of them.
So it's just kind of an emotional burden that's on them many times, and sometimes they don't even realize it.
Yes, and to mention, if you want to look at gender roles from another perspective, a lot of men come into marriages expecting that that's what their wives are going to do because maybe their mothers or grandmothers did that. And so unless there's really good communication at the beginning of a relationship, you may hit some troubled waters once you get into bringing a family on board with all of these uncommunicated expectations.
So some of these unspoken roles or unspoken
expectations.
Just expectations. Okay. Right,
yeah.
right. Mm-hmm. So what are some barriers you see people face in getting the help they need?
Well, I think first off, not having a social support group or family that's local can be a really big barrier to getting the help that you need. Say that you've had surgery or are incapacitated, had a baby or whatnot. And I think in a situation like that, especially with having a child, you're given the benefit of being pregnant for hopefully 9 to 10 months. I know not everybody has that experience. Many people have to deal with premature births like myself, but you do know that you have some time on your hands. You have a window of time that you can take advantage of. You can be proactive during this time, hopefully, unless you're not on bed rest, but you can reach out to your church. If you're a member, that's great. Then you've already got a group of people. You may need to narrow in, though, on things like a women's Bible study, a circle group, the nursery. All of these are opportunities that you could plug yourself in to meet more people, build some relationships there that could end up being the kind of relationships that would help support you in times where you need help.
So what I'm hearing is what's ideal is that you go ahead and be proactive and form a social support group before any of these surgeries or pregnancies or times that you may need people. That if you've already done that by maybe volunteering in the nursery or spending time in Bible studies or just being involved, I guess, in other people's lives.
Right. And that's what relationships are all about. They can't be one-sided, So
it's an investment.
Right.
When someone needs to get help from people around them, how should they go about it?
I'm going to address those who struggle asking for help next. I think that's like we were talking about earlier about a barrier that gets in the way. If you have trouble asking for help, you need to recognize that you have difficulty being assertive or direct with people.
Okay, so let's say you've recognized that you need help and that you are going to ask, what's the next step?
Well, if you're blessed to have people offering to help, I know I sure did. I had a lot of help, and I was very fortunate to have that. Don't leave them to their own devices. They cannot read your mind. They may not know that you have a ton of food in your kitchen and bring you another casserole when all you really need is somebody maybe to go to the drugstore and pick you up a prescription or to help you with your laundry.
It sounds like you really need to be more specific, I guess, in what you tell others.
Right.
So sometimes family and friends struggle with how to help. I can imagine from the helpers it would feel good that they are actually accomplishing something that you really need done.
I think it's important to understand that others can get frustrated when you're not direct with them. You may think that you're being nice by not being direct. I know I struggle with this. But really, you may think you're being nice by not being direct, but you could actually be frustrating the person trying to help.
When you're passive with them or being nice, it actually can harm that relationship or at least frustrate the person trying to help.
Exactly.
So they feel like they don't have any direction or that they're just shooting in the dark in how to help. And
right. So people, they basically rely on the rote expected responses. They think, well, okay, well, you need food, or you need, they only think basic things because those are kind of going back to what we were talking about earlier about tradition. I mean, that's, what you do in the good old Southern home is you bring them a casserole if all else fails, you don't know.
Right. So when you're direct, people feel like they're contributing. Giving someone a specific task can make them feel that they are truly helping you.
That's right.
Moving on, you mentioned a story earlier about a woman who could have really used some help from her visitors after the birth of her baby. It sounds like the visitors may have not been asked to help or that they may not have wanted to. Do you find that some people are not really there to help?
Unfortunately, yes. I think it's part of human nature. I hear these stories playing out time and time again. To use the example of a new baby, recognize that some people are not really sincere about helping. They may want to look like they're helping when in actuality they have an ulterior motive. They really just want to coo over the baby.
So they're really not there to see the mother or help the mother, but their focus is really on the baby more so.
Right, and I think that this kind of is bleeding into a topic that hopefully we'll do in another podcast, which is postpartum issues. But yes, I think a lot of women struggle with being a new mother, and this may make it harder to be direct with people, is trying to find your way as being a new mother. And here you have a group of people in your home. You feel like you need to entertain them, but you really don't have the energy to do it, and they're just sitting there cooing over the baby.
So these new mothers, sounds like they have a lot of mixed emotions.
They do, and you throw hormones, your hormone soup basically at that point. So being able to be very clear-headed, it's difficult. I think most women, if you were to ask them a few years after the birth of their babies, they could probably be a little more clear about what that experience was like. If they had a chance to do it over, what kind of help they would have asked at the time. But when you're in the thick of it, it can be pretty difficult to be such a leader, really, because you're having to take on some leadership skills to be that direct.
The new mothers many times kind of foggy, or at least they don't have the energy or the focus to be able to lead well.
That's right, and that's why it's important for the husband and other family members to kind of step in and help maybe sometimes in being direct with the people that come to the household.
With a new baby or with a surgery, maybe what's most helpful is planning beforehand about how things are handled.
That's right, as best you can. And I realize that some of the listeners today may not have that benefit. So we're going to address that too.
Okay, so they may be a little bit too far down the road and where they've not been able to address their wants and needs and plans during or after the pregnancy. So it sounds like you're saying that getting the help you need is a true test of being assertive.
I think it's about being assertive. I think it's about knowing how you are with other people. It's about making the decision that you really are going to get what you need done versus leaving people to their own devices.
So tell me more about assertive. Tell me, what do you do with these people who are not there really to help?
The people that coo over the baby.
Right, the cooing people that seem to be or act like they're there to help, but they're really not so much.
Okay. Well, if you notice that someone is not helpful and you've been direct with them, it may be in your best interest to delegate tasks to the others who are more helpful rather than keeping up the charade that the other person is helping. Spinning your wheels with them, basically. Because if they're not there genuinely out of the goodness of their heart to help, and you just kind of lead them on and make it seem like you're happy that they're doing that, it's just going to result in more frustration. So at this time, when you've decided that this person really isn't being helpful, it may be a good time to say, hey, thanks for the visit, we're going to need some rest now, and send them on their way.
So you're saying that's a way to be assertive with them?
That's one way.
Okay.
That's one way, but another, and this is a technique that we teach in counseling, is called the sandwich technique. And I think both of us could probably give some pointers in this department.
Yeah, so when I think about my couples or that I'm meeting with, many times when I say assertive, I use that word, but I really don't know what they're thinking when I say that.
Yeah, you don't know what their definition of assertive is.
Right.
A lot of times they think it's aggressive.
Right. Many times that assertive is mistaken for being aggressive, especially for someone who's passive. They think, gosh, you mean I need to get mad at them or mean to them or something like that. That's not at all what we're talking about. So I like the definition, or the one that I like to use, is to be assertive, first of all, means that you are relaxed when you're talking to them. Your voice, your body language is relaxed. It's kind of like we're talking with each other right now. Right?
I like to use the word casual.
Okay, yes, casual.
Because you can be quite direct with someone and use language and demeanor that is casual.
Okay, so something casual, Bermuda shorts type talking. Yes, okay. So,
well, no, I mean, it's like they don't really even know that they've been hit with direction. They don't even realize that you've told them what to do.
So if you do it really well, if
Yes.
if you do a good job of being assertive, then maybe at times the other person doesn't even realize it.
That's right.
That's what I'm hearing. Mm-hmm. So assertive is speaking in a casual manner what you need, feel, or want directly and honestly, but in a casual manner, not yelling, not jumping up and down,
Not glaring at them.
yeah, not glaring, not rolling your eyes, not pointing your finger.
If you don't make a big deal about it when you're doing it, then it's not going to even show up on their radar that it's a problem. It's not going to escalate.
So if you're doing it well, then many times the other person's not offended, or at least they don't realize it. They feel good about themselves as you feel good about yourself.
And then that's what assertiveness is all about, is just treating each other as equals.
So tell me about the sandwich technique.
Okay. Well, if you can imagine a sandwich, bread being positive, the meat being the not so positive thing that you're trying to get across, and then
But I like meat.
well, and with the sandwich technique, the meat is really very important because that is the message that you're trying to get across.
So, Laura, tell us how you would use the sandwich technique with this person who just wanted to really come and just coo with the baby.
Okay. Well, I think first it's going to be really important that you establish a comfortable environment for that person. You don't want to put them on the defensive. And so in order to do that, you may have to distract them and kind of pull them away. You don't want them to be in the midst of other people when you address this issue. So you may say, hey, Aunt Sally, why don't you come over here a minute? I want you to try this potato salad that Aunt Martha brought. That way you've opened the door for them time to kind of get away from the other people. That way you can address the issue one-on-one.
So what I'm hearing is you're establishing positive atmosphere with them.
That's right. And what I said was a very casual thing. Hey, somebody brought this food. It's really tasty.
So it's very non-threatening.
Very non-threatening. And it's welcoming. It's welcoming, too.
So that food's non-threatening. Food is something that eases people's feelings many times.
It's kind of like a peace offering if you think about it.
Okay. Right.
So you establish that comfort level, that environment of comfort. When you get them over and you say that about the food, you can start talking about, oh, it's great that you came today. I really appreciate you coming. And that's the positive start of the sandwich technique. Because if you look at the sandwich technique, imagine like a line drawing of a sandwich or a sandwich in general. Imagine the bread being the positive, the meat being the content, the point you're trying to get across, and then the other piece of bread being another positive thing. So I don't want to look at the meat as a negative thing, but just as the area that you need some help with, the area that you may consider negative or that you may have to be a little direct with. So we've already established a comfort level. We've created a comfortable and casual environment by bringing Aunt Sally over and separated her out from the crowd. That way she doesn't feel like she's being put on the spot, and so she won't be defensive. So at this point, you've got her trying the potato salad now.
Okay, so you got her where she can't talk.
That's right. Yeah, you've got her mouth full. Okay. And this is the point where you say, goodness, I have not had a bath in I don't know how many days, 3 days. And it would be really great if you can help me out here and maybe for 15 minutes watch the baby. That way I can get a shower right quick. Wow, you just finished that off with another positive. This is the bread. You're closing your sandwich right here with, you really came at a great time. It would be awesome if I could just have these few minutes just to take a shower, and I'd really appreciate it.
Wow, so you start off positive, the first bread part.
Right.
And that being the atmosphere and making sure they feel comfortable and relaxed so that everything's casual. And then you get to the meat, which is the portion that really you want to convey to them.
Right. That's the message that is the thing that you need to get done.
And then you ended up with positives.
That's right. So nothing that was ever said was anything that could really make somebody really all that defensive.
If it's done well, it should make the other person feel calm.
Right, and this may be kind of like a foreign language to some people. I realize that assertiveness and utilizing the sandwich technique may feel kind of foreign to you. You may need some practice in it. It can be difficult using this kind of language in a casual way, so you've got to just start practicing.
Right, well, and what I tell my clients are that being assertive is very intentional. If you're not assertive, then you really have to think about it. You have to plan it out. And sometimes I even have them write down what they want to say beforehand so that they can, like you were saying, Laura, practice.
Right. So they're prepared. And at some point, it's be like riding the bike where you can do it without thinking. But if you're not accustomed to being assertive, you have to really think hard.
So part of this about getting help or making sure that you're handling people who are there to help is this assertiveness, this really speaking what you feel, need, and want directly and honestly without talking over someone, without yelling or giving some negative body language with it, but in a calm manner.
Right.
Another problem, Laura, maybe with this area is could be pride. How would you see pride as an issue?
Oh, that's a really good one. I think this goes back to identifying too much with something sometimes. It's not uncommon from what I see with my work to see people that are people pleasers. And I think a lot of times people pleasers kind of pride themselves in being nice. If we go back to what we were saying at the top of the broadcast here, that they try to be the person that doesn't rock the boat. But in doing so, it's become a pride issue.
So what I'm hearing is it's hard for the people pleasers to accept help.
That's right. They think, well, I do everything right. I do everything by the book. Everybody thinks I'm a good person. I'm a good person.
So what I'm hearing is they're telling themselves they're not a good person if they have to get help.
Or that they're not a good person if they have to be direct or if they ask anything of anyone.
So there's a lot of these maybe voices, well, I'm not saying voices in their head, but maybe some,
messages.
Thought messages that they're going on internally that they're thinking about, that I'm not a good Christian if I
reach out to someone, ask for help, or get specific with a person. Another thing that I see with pride, and I'm going to use the example of the perfectionist here, is, if your identity is completely wrapped up in keeping a neat, tidy home, and then you're blessed with triplets, and someone shows up at your house, you're going to feel that kind of punch on the stomach, pit of your stomach feeling, and your heart's going to sink because you know that tidy house, that image that you used to try to present is no longer there. That pristine home, it no longer exists.
That sounds like it could really be a heart issue. So how do we address pride in our hearts?
Okay, Vincent. So I think we could do a number of podcasts on pride, but to keep it brief, I would say first you need to recognize that this is pride that you're dealing with. Second, I'd take a look at how your pride affects your relationships. And then third, I'd kind of take a look at the negative behaviors that you're exhibiting because of your pride.
What do you mean? What kind of negative behaviors?
Not being one to apologize readily. I think a lot of times pride in the heart can kind of have the heart hardened that way, and so it's hard to be kind of humble and apologetic. That would be one negative behavior. Maybe not being able to accept love or gifts, that might be another behavior. You'd be like, I can give you an example here. Say somebody gives you a compliment. You're wearing this dress and they say, oh, that's a lovely dress. And you say, oh, this old thing. That could be pride right there too. Not being able to accept a compliment. That somebody's trying to say something out of the goodness of their heart. That kind of undermines that other person's attempt at trying to be nice to you.
So it really makes it difficult for someone to be assertive with you when you're always putting down what they're saying.
Yeah, and if you think that you're the good, nice person all the time, it almost justifies things in a way because no one's ever nice to you if you never accept it, really. If you can't see it, that they're being nice to you, then in a way you've elevated yourself. You've put yourself on a pedestal.
You're too good to allow others to be nice to you.
Right. Once you've, been able to recognize some of these negative behaviors that you're doing, you've got to do the biggest job of all, and that's take it to God. You got to tell him what you're doing. He knows what you're doing, but he wants you to see it. So that's a time where, you're communicating with God, and you're letting him know, okay, these are the things I'm seeing in myself. I see these things in my heart, and you're having to ask him to help change these behaviors, change these things about your heart, and then you've got to listen to him, and then you've got to get that insight from him.
So to recap this show, when your help doesn't help, you may need to not only examine the other people, but really examine yourself and the situation. Here's some questions to keep in mind. Am I being direct enough? Are others frustrated because I'm not direct? Am I giving specific tasks? Am I delegating the task to the right people? And lastly, is my pride getting in the way of getting the help I need? Thank you for joining us today on Relationship Helpers with Vincent and Laura Ketchy. It is our hope that you gain some valuable information from this program. For notes and more information on today's topic, visit our website, relationshiphelpers.net. That is relationshiphelpers.net. Thanks for listening, and have a good week.
Note that accuracy and authority in regards to the subject matter covered today is not a replacement for professional care. Neither the host, the clinicians, or the guests are rendering clinical or other professional advice. Seek professional help if you need it.